Hello everyone and welcome back to Mira Anat. Today we are going to discuss how to count the ribs in a chest x-ray. Okay, well, you might ask yourself a question, why do we need to count the ribs? First of all, we need to count the ribs for two points or two reasons. First of all, to identify the location of the heart apex, if it is in the normal location, which is the fifth left intercostal space, yes or no, or it is shifted down below sometimes. This is one. Second thing, through counting the ribs, we can on each side determine or draw the extent of the lung lobes on each side, and because of that or based on that we can determine the pathology located in which lobe of the lung. So first of all, let us learn about how to count the ribs in a chest x-ray, normal chest x-ray. First of all, the ribs that we are going to count the or follow the anterior ends of the rib. What do you mean by counting the anterior ends of the rib? Usually, whatever we are seeing here, these are the posterior ends of the ribs because this is postero-anterior view of a chest x-ray. Fine. So if this is the posterior ends of the ribs, where is the anterior ends? The anterior ends of the ribs, if you want to follow them out, you will find that this rib, for example, its anterior end is like going like that, and the above one is going like that. This is the anterior ends of the corresponding ribs. Okay, so to count properly, to count and rely and locate the apex, I have to count the anterior ends of the ribs. So how to trace it, how to find it? Go to the margin of the rib cage or thoracic cage, and then from there you start counting. So this is the shadow of the first rib, and here I'm talking again about the anterior ends. Then this is the second rib, then this is the third rib, followed by fourth rib, then fifth rib, sixth rib, seventh rib, and a little bit part of eighth rib. Now, for example, to apply the information we were talking about, the apex of the heart should be located in the fifth left intercostal space. So that's mean this is the first space between the first two ribs, then second space, third space, fourth space, fifth space. So where is the apex here? This is the apex of the heart, which is formed by the left ventricle. So for example, here I could locate that the apex position is located normally. It is not shifted down because it might be shifted down in case, for example, of left ventricular hypertrophy or dilatation. So it is mandatory for each student to know how to count the ribs. Thank you.